Welcome back to Chapter 6, the Integumentary System. In Part 1, we covered the epidermis, the dermis, and the hypodermis. So what we'll do in the last part of this particular chapter is we're going to take a look at the melanocytes a little bit further. And I also want to discuss with you different clinical applications, such as different types of skin cancer, as well as some of the effects that burns can have on the skin, as well as its accessory glands. So let's go ahead and see what part 2 has in store for us. All right, so let's start off with melanin. We discussed the fact that one of the most important cells that you find within your epidermis layer or the top layer of the skin is going to be your melanocyte cell. And the melanocyte cells get their name from the fact that they're able to produce melanin, which is a pigment. There are different versions of melanin. From a genetic standpoint, the version that you produce will determine what your overall skin tone will be, as well as what your overall hair color, for instance, will be. So you have eumelanin, which is more of a brownish black coloration, and faux melanin, that one gives more of a reddish yellowish formation. So for instance, someone who genetically has naturally blonde hair, they produce high levels of faux melanin, whereas someone who has more of a darker, more of a brown or black tone to their hair, that's eumelanin. Most of the time you do secrete both versions, but depending on how the ratio of them are or the quantity of each is, will have an overall effect of the color that's being projected. Now, something that I want to point out to you is the fact that it turns out that when we look at how many melanocytes we have, so how many of the cells we have that are able to secrete melanin, it turns out that most of us have the same amount of melanocytes. So we have the same number of cells. So how do you then have such a wide variation in beautiful skin tones? Anywhere from a very pale to a yellow to a light brown, a darker brown, all these beautiful shades that are available out there. How can you describe different skin tones if we all have the same melanocytes? Well, it turns out that even though we might have the same number of cells, these cells do not produce melanin at the same level, nor are our keratinocytes, or skin cells, able to display this beautiful pigment in the same methods for each person. So go ahead and take a look at your PowerPoint towards the bottom, and it says right here that someone who is naturally darker skinned, what we see happening from a genetic standpoint is that their melanocytes will produce higher quantities of melanin, so they produce the pigment at a higher level. The pigment is very slow in breaking down, and more importantly, it's easily absorbed into the keratinocytes, so into the skin cells, which then gladly put the granules on full display in their cytoplasm, allowing the beautiful shade or pigment to peek through the skin color. On the other hand, someone who is a light-skinned individual, what we see happening is that their melanocytes, one, do not produce as much melanin, and also the melanin that's produced is not as easily taken up by the keratinocytes. And when it is taken up, it tends to be clumped together or clustered together in the nucleus, thereby leaving the remainder of the cell colorless or unpigmented. And hence what we see happening is very little pigment peeking through the stratum basale. So I can show you this a little bit better on a histology slide. So let's just click on over. Here you go. So let's go ahead and take a look at someone that genetically is dark skinned versus light skinned. Now notice in their epidermis, same amount of cells, however, their cells are differently stained. In an individual with a dark skin tone, we see that their epidermis has a brighter purple, pinkish format. Now, these, of course, are dyes, but notice how the dyes are easily able to go into the keratinocytes, the skin cells, and how they're on full display within the cells. And that's the same thing that we see happen with the melanin. The melanin is easy to be absorbed, and it's on full display, very slow in breaking down, hence producing a beautiful dark skin tone. The light-skinned individual on the right-hand side, notice how their keratinocytes are not as brightly colored, and that's because the dye that was used had a hard time penetrating and being displayed by the keratinocyte. We see the same thing happening with the melanin. The melanin is hard to absorb into the skin cells, and when it is absorbed, it's clustered together and not on full display. Oh, I also want to point out, remember that the whole purpose of melanin production is that it shields the body from the damaging effects of the UV rays of the sun. So this then helps us explain why some of us are able to tan while some of us will burn. When you go into the sun, you might notice, or I should say, when you go into the sun consistently, you might notice that your skin tone will darken. And that's because the body will start producing more melanin, which makes it more likely for the keratinocytes to absorb it. Hence, we get a little bit of a tan. If we now go out of the sun, oftentimes we see that the melanin production will diminish, and therefore we go back to a lighter or not as dark coloration. Some people are not able to generate enough melanin quickly enough to protect the body from the sun layers, and that is then when we get sunburns. Sunburns, meaning that the skin turns red and flushed and is painful, is due to the fact that the sun rays had absolutely nothing that was holding them back from destroying or damaging your keratinocytes, and that's because the melanin levels were not high enough to provide protection. So that's why it's so essential to always have on sunscreen, because the rays of the sun can be very powerful and harmful, and we might not always, or all of us might not have the same level of melanin protection that is necessary to keep our skin safe. All right, I also want to quickly talk about cutaneous glands. So glands are going to be structures that are embedded within the dermis layer, and what we see happening is that they're able to produce different types of secretions. So we're going to focus on the three most common glands. We're going to take a look at the apocrine gland, the merocrine gland, and the sebaceous gland. All right, so let's start with our sweat glands. These are called our apocrine and merocrine gland. Now, when we think of sweat, we often think of a watery, transparent secretion, and it turns out that our body is able to produce sweat in many different ways. Some of the sweat that we produce is in such a thin layer that we don't even notice it. Others, of course, will be at a higher level, which is then when we think about things like perspiration, and we might notice that we're sweat forming on our forehead or stains on our body from where the water is being released. So, two types of glands will be able to produce sweat. We have our apocrine gland on this particular slide. These are the glands that we associate more with our groin, axilla, which is the armpit, areolar, beard area in men, or anal region. Now, these sweat glands will produce more of a type of milky secretion that is full of fatty acids, so it's not necessarily wet, transparent secretion. And the reason for that is because the apocrine sweat gland, due to the location that it's in within the groin region, as well as the armpit, it often responds to a stress as well as sexual stimulations. So what we see happening here is that often people will talk about the fact that this secretion, less water, more milky and fatty acids, is considered a pheromone, a specific secretion that can be used to influence the behavior of a mate. Now, I do want to say that research out there is not conclusive when it comes to humans if we're able to, one, produce pheromones, or two, if we do produce the pheromones, if we respond to the pheromones. But what we do know is that people, especially if they're in a coupled relationship, will tell you that each of them has a specific scent. And also what we know happening is that if we do produce pheromones, we make it a little bit hard for us to respond to it, because most of us will do things like bathe, shower, put perfume on, put cologne on a regular basis. And all these things help mask the natural pheromones or odor of the body. Another interesting fact, and it's at the bottom of your slide, is the fact that the body odor that we experience with excessive secretions actually have nothing to do with the secretion itself. The secretions, whether it's full-on water, sweat, or the milky secretion of the apocrine sweat glands, they're actually odorless. We only develop a stench when the liquid seeps into our clothes making it easy for bacteria to start interacting with it. And when the bacteria action starts to occur, that is then when the odor, the from the rhizosaurus, comes along. Merocrine sweat glands are the ones that we most likely know most of. That's the one that we associate with actual watery perspiration. They are the most numerous skin glands that we have. You have them all over the body, especially within the palms, the soles, and the forehead. Its main purpose is to produce a watery secretion, and that watery secretion actually is meant to be a cooling mechanism. So it's one of the ways that our body can maintain homeostasis and keep us at a consistent body temperature regardless of the environment that we put ourselves in. Now, here's just a little look at sweat. I've said some of this before, so please excuse my redundancy. Let's see happening. Most of sweat is mostly water. It comes from the blood plasma, which is the liquid portion of the blood. We do know that within the sweat, there will be some sodium chloride, some salt, as well as some solutes. Studies have shown that we can also use sweat as a method to cleanse the body in addition to its cooling mechanism. So we know that some drugs and toxins can be secreted from sweat. Your pH of sweat tends to be in the acidic range. So it falls below 7, and that is then why oftentimes when you take a look at the effects that sweat have or contribute to the skin, you're going to come across this term right here, acid mantle. The overall pH of the skin due to its production of sweat is acidic, and that turns out to be very influential in inhibiting bacterial growth from occurring. So this is one of the reasons why it's so difficult for bacteria or fungi to grow on our skin, because of the acid mantle that it forms. Obviously, if you have injury to the skin and you have an open wound, you want to shield that from infection because the opening has exposure to the blood vessels, which means that there's lots of nutrients that's available for pathogens to kind of utilize in their proliferation. Towards the bottom, it just talks about the fact that you can have perspiration that is what we consider insensible, meaning that you don't even really notice it. These tend to be more towards the groin area. And then obviously you have your diaphoresis, which means that you have excessive sweating or excessive wetness that's experienced. Each of this will have to do partly based on our genetics as well as the environment that we place our body into. All right, now our next glands are going to be our sebaceous glands. Sebaceous glands produce sebum. Sebum is more of an oily, lubricating secretion. A best example of sebum is for many of us will see within our scalp. If you don't wash your hair on a day-to-day basis, so there's days, or depending on your hair texture, sometimes it could be weeks that you can go without actually washing your hair. One thing that you might notice is that at certain points, your hair will turn a little bit oily, and you'll feel it on your scalp. That oil that you're feeling is due to the sebaceous glands. Its main purpose is to kind of lubricate the skin and the hair so it doesn't become dry or brittle. And a fun fact is, every time we step into the shower, obviously we rinse off this excess sebum, especially if we're going to be shampooing and conditioning our hair. And then here's another interesting fact. For those of us who like to apply lotion to kind of smooth up our skin and to hydrate it, next time you're applying your lotion, go ahead and take a look at the ingredient list and see if you can find an ingredient labeled lanolin. Lanolin is sebum secreted from sheep, and it's actually one of the common ways that lotions get their lubricating ability. So isn't that interesting? We take the sebum from one animal and we kind of slather it all over ourselves to help keep our skin nice and conditioned. Cutaneous glands are exclusively found within the external ear canal. So this is what produces your earwax. So here you go. They are modified apocrine glands. only found in the ear canal. And what's going to end up happening is that they will take sebum as well as any type of dead cells that are flaking up within the ear canal, and they will wrap it around any type of pathogen that tries to enter into the ear itself. This is then what you see when you take a Q-tip or any type of cleaning mechanism and you clean out your ear canal, and you see that the yellow extract that comes out of it. It turns out that this wax or earwax is very important because it's going to help us waterproof the canal. It also has an antimicrobial ability, and more importantly, it works in conjunction with the little hairs, the little guard hairs you have in your ear canal, to make it harder for any type of foreign entity to kind of crawl into your auditory or your ear canal. So make sure to tank your earwax next time you're cleaning it, because it does have a very important job. Mammary glands are going to be our next category. Now, mammary glands are a modified apocrine sweat glands, and mammary glands will come into play during pregnancy as well as afterwards when the woman is lactating. Now, they're modified sweat glands because instead of producing sweat, they will produce milk, which is often extremely essential for the newborn baby in the sense of not only providing nutrition, but also some of the immune system capability, since antibodies are able to pass on from mother's milk over to the baby. The mammals have what we like to call milk lines or mammary ridges. These are two rows that run down the ventral, the belly side of the animal, and along the way you'll have nipples that will form as areas where milk can be secreted. Now, for humans, we tend to just have two nipples. However, there has been a case where there becomes a little genetic imperfection and a third nipple comes along the way. That third nipple will tend to develop along the milk line, and oftentimes it will be a non-functioning structure. So it will just kind of be a little mutation. It doesn't cause any harm to the body, and it also does not produce any milk in case there is a pregnancy or lactation period. When a woman is not pregnant and no longer lactating, we see that the mammary glands will go ahead and shut down, and they will stop producing milk. All right, now at the end part of chapter 6, I want to take a few seconds out and definitely talk about some clinical applications, some disease models. And I think since most of us live in Florida, we're exposed to a lot of sun. We tend to go out a lot in the sun and enjoy the beautiful weather. And that's one of the reasons why I wanted to talk about skin cancer. Now, skin cancer is most often caused by the damaging rays of the sun. So that is why it's so essential to always have on sunscreen, and of course limit your time into the sun exposure as well. And remember, we had our whole discussion about melanin production and its natural ability to shield the system. Now, skin cancer can also be caused due to genetics, so it's not only an environmental disease. Most of the time it's a combination of both. And you can be as safe as you want and still have it, or you can be as relentless in the sun as you want, and some people will never have it. So just because your activities doesn't necessarily correlate with your chances of developing the cancer. My apologies, I'm ranting a little bit onwards. Either way, on our PowerPoint, it says right here is that skin cancer, often seen by the head, the neck, and the hand region. It is more common in fair-skinned individual as well as the elderly. Remember, with the fair-skinned individual, this makes sense because of their lowered ability to extract and display the melanin in their keratinocytes. And the nice thing about skin cancer is that if it's caught early, it tends to be very easily and successful in its treatment mechanism. I want to just take a few seconds and also show you some illustrations and talk about the three types of skin cancers: basal cell carcinoma, squamous cell carcinoma, and melanoma. And what you're going to notice is based on your name, it will correlate where they originate and which cells they involve. So let's start off with basal cell carcinoma. This is the most common type. It is also the least dangerous, and that's because it tends to be a very localized cancer. So a cancer that doesn't easily metastasize, spread over to secondary location. It gets its name basal cell carcinoma because it involves the cells in the stratum basal, so the bottom basement layer of the epidermis. And as you can see from the illustration, usually it will pop up as a lesion. Most people will tell you they'll have like a little bump, a shiny structure that appears, and it will be very asymmetrical in its appearance and have, as you can see, oftentimes a little depression. The next one is the squamous cell carcinoma. The squamous cell carcinoma comes from the fact that it affects the skin cells, the keratinocytes that are in the stratum spinosum. Usually people will see these lesions appear on their back of the hand, the scalp, as well as some of the ears and by the lower lip. As you can see from the illustration inserted, it tends to have more of a reddish scaly appearance, and it can actually form an ulcer that will pop open and kind of concave, so dip inwards. Once again, if it's discovered and treated early, excellent recovery rate. However, we do have to be careful with the squamous cell carcinoma because it does have a tendency to metastasize. So the earlier we catch it, the better the prognosis is. And our third one, this is the one that is the most lethal. This one is melanoma. Melanoma gets its name from the fact that the malignancy, the cancer, is in your melanocytes. All right, now as you can see right here, it says it's less than 5% of skin cancers, but it's the most deadly forms. And this is why it needs to be caught as early as possible. And this is one of the reasons why those of us who tend to go to the dermatologist consistently will notice that one of the things that they always do is to take a look at your moles and your freckles. Moles and freckles are basically accumulation points or gathering points where you have lots of melanocytes, and that's why they tend to have a darker color than the rest of the body. Now you want to make sure that these melanocytes are behaving, so you want to check the A, B, C, Ds. You want to check the area, you want to check the border, you want to check the color, and you want to check the diameter. So you want to make sure that the area stays nice and contained, the border is nice and smooth, the color tends to be overall uniform, so the same color, not like the one pictured right here where you have light areas and darker areas. And the diameter indicates that it doesn't actively grow. So we don't want it to get larger because that often can indicate that you might have some malignant growth. So please keep an eye on those moles and freckles, and whenever in doubt, definitely visit your dermatologist so that they can take a look at it. I do want to point out that there are lots of different skin anomalies, so not because you see an external growth or an abnormal formation, it's necessarily cancer. But obviously it's good to be educated so you kind of know what to look out for. And the early detection is key. All right, and then one last thing to discuss, burns. Now, burns are essential to discuss in the integumentary system because remember, our skin forms this beautiful waterproof layer that keeps us hydrated on the inside and makes it very hard for pathogens to penetrate through this protection layer. When you have a burn on your skin, and it can be from anything as simple as a sunburn, an actual fire burn, maybe a chemical burn, what we see happening is that anything that can cause the layers of the cells to be damaged and to start being diminished, it can cause not only an increase of infections to occur due to the exposure of the blood vessels and also an increase of bacterial and pathogenic infections, but also it can cause massive fluid loss. And this is all due to the fact that we start losing that waterproof layering capability. So it is essential that with burns that we seek proper treatment because we want to minimize the amount of fluid loss as well as secondary keep an eye on infection that might occur. Now when it comes to classifying burns, we can either have a first-degree burn, a second-degree burn, or a third-degree burn. And it will all depend on how many layers of the skin are involved. Starting with the less severe one is the first-degree burn. This is when you have damage done to the epidermis. Now remember, the epidermis does not have vascular tissue, meaning it doesn't have blood vessels. So in this case, what we see happening is that if you have any damage done to the epidermis, we'll usually notice that we have lots of redness, which has to do with inflammation. You can get some blisters that will start to form as water accumulates between the epidermis and the dermis layer, and you will also have some pain courtesy of those tactile cells. Most of us have had first-degree burns before. Sometimes it could be because we were in the sun for a little bit too long, and then we'll notice that our shoulders or our foreheads turn bright red due to the pain. You might have even, put your hand on something hot as well and notice that you have the reddening at the area that was affected, but you don't have any bleeding. You just have slight pain. Usually first-degree burns will heal up in a couple of days. If you have a burn that goes through the epidermis and the dermis, then you have a second-degree burn. Now, this one tends to have also the appearance of blisters. It can be very painful due to the excessive damage that's being done to both the epidermis and the dermis layer. And because you are missing so many layers, it takes longer. So as you can see, it says weeks to months to heal up. And it turns out that your dermis layer, because it's of connective tissue, it doesn't regenerate as quickly, so it doesn't heal up as quickly. So oftentimes those cells will go ahead and produce high levels of scar tissue to kind of heal up the opening as quickly as possible. The worst kind of burn is a third-degree burn. In a third-degree burn, we have gone through all our skin layers. So we have gone through our epidermis, our dermis, and we're even affecting our hypodermis, our unofficial third layer of the skin. The problem with third-degree burns is its massive amount of fluid loss. So our primary focus will be on fluid replacement. We also need to obviously keep an eye on infection control, and usually with third-degree burns, because of the massive amount of cell loss, it will require skin grafts for the healing process to be successful. And part of that comes from the fact that studies have shown that when the keratinocytes, the skin cells, can make physical contact with each other, they tend to repair faster. In a third-degree burn, there's a large gap, a large opening between the keratinocytes, so it makes it harder for them to physically connect. This can lead to ganglia or dead tissue to form. So instead what's offered is a skin graft. And skin graft means that we take skin from another part of the body or from a donor, and it's basically thinned out and it's laid over the wound so that we can artificially connect the keratinocytes and make it more likely for them to repair themselves, and obviously thereby reduce the amount of fluid loss and lower our chances of infection. Here is a quick little illustration. So let's start on our top and follow the yellow arrow. As you can see, if damage is only done to the epidermis, we get the redness that we associate with a first-degree burn. If the arrow keeps going through the epidermis and the dermis, then we get a second-degree burn. Notice how you have the blistering that will appear as well. And then a third-degree burn is, as you can see, when you go through the epidermis, the dermis, and even affect the hypodermis. As you can see, this one is the most excessive one. I also want to point something out about third-degree burns, which is initially when it occurs, because you damage all the different layers, you also damage the nerve endings, which means initially it doesn't hurt because there's nothing for the nervous system to interact with. But when it starts healing, it's going to be an excruciating pain, not only because all the cells and layers that need to be restored, but also the different nerve endings that have to regrow and regenerate themselves. All right, so having said that, I think this is an excellent time to kind of conclude Chapter 6. As always, if you come across any questions, you have some comments, you have some concerns, please do not hesitate to contact me. And the next time we will meet is when we start exploring Chapter 7, and we're going to switch from the skin, and we're going to start taking a look at bones and what they contribute to our body. All right, talk soon.